Hi, my name is Shannon Simmons. I am a student of Professor Wetzler's Health Assessment 1 class. I'm in her Wednesday class. This is my assessment for week 6, the heart and neck vessels. Here's my student ID. Sorry about the glare. My D number is 41096497. This piece of paper, previous failures on it. I don't know if you can see that. Blank on the other side. Here's my pen. Here are my trauma shears. Pen light that is on. And my stethoscope. This is my patient, Bear Smith, and we both give you permission to view this video. I'll go ahead and get started. Hand hygiene as I walk in the door. Hi, Mr. Smith. How are you today? Good. My name is Shannon. I'm your student nurse. I'm part of your care coordination team. I'm here today to make sure everything flows smoothly for your visit. Okay? All right, so I have an important job to do today. I'm going to be doing an examination of your heart and the vessels in your neck. So the first thing I'm going to do is I'm going to look at everything. Then I'm going to palpate everything. And then the very last thing I'm going to do is listen to you. Listen to your heart about 5 different places. So this should take about 10 minutes. Is that okay with you? Okay, do you have any questions before we get started? No? Okay, thank you so much for your time. I appreciate it. Before we do go ahead and get this started with the assessment, I'm going to ask you a couple questions. I need you to tell me your name and date of birth. Bear Smith, 11/12/75. Okay. And do you have any allergies to food or medications? No allergies? All right. So the next question I need to ask you is to see if you're in any pain. So we're going to do this by using a scale of 0 to 10, 0 being no pain at all, 10 being the worst pain you ever felt in your life. What would your number be right now? 0? Okay, we like zeros. All right, so we are going to go ahead and get started with the assessment now. What I'm going to do is I'm going to have you lift off your shirt so we can listen and look and feel your bare skin. And I've made him a clavicle and a sternum just so I can have my bearings when I'm doing the auscultation portion of the assessment. So Mr. Smith, the first portion of the assessment is going to be me just looking at everything. I'm going to be looking at your neck, at your chest. First thing I'm looking for, I'm looking at your carotid to make sure there's no increased pulsations, that you don't have any jugular vein distension just sitting here. Jugular vein distension. Your pericardium, which is the space on top, right on top of your mediastinum. I'm looking at your pericardium to make sure there's no lifts or heaves, which I don't see. And also I'm going to be checking your pedal pulse, which are on your feet on the top portion, or not your pedal pulse, I apologize and correct myself. We're looking for pedal edema to make sure that you don't have any swelling down on your feet. Okay, there's no swelling down on your left foot. Checking your right foot, no swelling on that foot either. Okay, so that's for the inspection part. His skin tone is even and consistent throughout. He has mild carotid pulsations, visible bilaterally when sitting. I didn't see any lifts or heaves at the precordium. He doesn't have any noted JVD when he's sitting. He doesn't have any pedal edema on either lower extremity. Okay, Mr. Smith, this next portion is a little bit tricky. We're going to lie you back at a 45-degree angle so I can see if that produces any jugular vein distension. I'm going to look at it on both sides, so when I lie you back, I'm going to ask you to turn your head to the opposite side, and I'll repeat on the other side, okay? So we're going to have to pretend on this one because the chair doesn't go back 45 degrees. It also doesn't stay. So we are now at 45-degree angle, a 45-degree angle supine, we're pretending. Go ahead and turn your head to the right. What I'm looking for, your jugular vein runs right through here. And at 45-degree angles, at a supine supine position, you should have some mild JVD, not a lot, but I should be able to see where your jugular vein is. So there's no huge large vein or large jugular distension noted. Okay, we're going to move to the other side. Again, still leaning back at the 45-degree angle. We're going to turn your head to your left, looking for the jugular vein. I can see it, I can visualize it, but there's no pulsations, it's not distended. Oh, sorry, I almost fell. Okay, so there's no jugular vein, start over. No jugular vein distension, or JVD, noted bilaterally on either side at a 45-degree angle in which we were pretending he's sitting. Okay, so we're going to go ahead and sit you up now, nice and normal. Again, okay, so this part is where I'm going to move around. I'm going to touch on your chest, on your neck, make sure that your capillary riffles on your hands are good. And so I'm going to start with your carotid pulses. We're going to check them on either side to make sure that your pulse is present, that it's regular, and I don't notice any thrills in there. Okay? So go ahead and lean your head back just a little bit. Find your trachea. Should be midline. Go over on the carotid pulse. It is present. The rhythm is regular. No thrills noted. Thrills noted on the left. Move to the other side. Find your trachea. Right. On the carotid. Pulse is present. It is regular. No thrills are noted. Okay, so next thing we're going to do is we're going to check the capillary riffle on both your hands. Hold it down. It's less than 2 seconds. Hold this one down. And it is less than 2 seconds. The last thing I need to do when I'm touching around with my hands, I'm going to feel for your apical pulse, okay? I'm going to explain where we can find that at. It's going to be the 5th intercostal space, mid-clavicular line. So we need to count down the intercostal spaces. The first one underneath your clavicle is 1. Count down 2, 3, 4, 5, and then I'm going to find your clavicle, go mid-clavicular, follow that line down. This should be your apical pulse. Your apical pulse is present. I can feel it for a size of about 2 centimeters. Okay, all right, thank you. So the palpation portion is over, so hold on 1 second. The cap refill is less than 1 to 2 seconds bilaterally. The carotids have a regular pulse in them. The rhythm is regular, and it's 2+ bilaterally with no thrills noted. The apical pulse is about 2 centimeters upon palpation. Okay, so that one's good. All right, so Mr. Smith, we're going to go ahead and move on to the auscultation part. And this one, I'm going to listen to your carotids. I'm going to make sure there's no extra sounds in there. It's called a bruit. And then I'm going to listen to your heart at 5 different spots. The first one's going to be on the right side, and that's the aortic area. Second one's going to be right on the other side of that. That's called the pulmonary area. And then you have Erb's point, which is right below that. And then you have the tricuspid spot, which is right below that on the sternal border. And then the mitral area, which is the midclavicular line on the 5th intercostal space. As we go through them, I'll say where they're at. And we're looking, when I'm listening, when I'm auscultating those, I'm listening above the valves for any murmurs, for any clicking, for any abnormal noises, just making sure that the valves are working correctly, all over the valve points, not on a Erb's point. Okay, so we're going to go ahead and get started with the auscultation. Again, we're going to listen to the carotids with the diaphragm first. We listen to the carotids with the bell. So I'm going to place it right above the carotid. I want you to take a deep breath and blow it out, and then I need you to hold your breath. Carotid pulse is present, regular, no bruit noted, no whooshing noises. Okay, I'm going to move to the other side. On the carotid pulse again. Carotid pulse is present. The rhythm is regular. No bruit is noted. Okay. All right. So now we are going to listen to your heart sounds. The first one, like I said, is the aortic area. It is the second intercostal space, the right sternal border. So again, we're going to find your clavicle, find the first intercostal space, count down to 2, the right sternal border. The first time we're going to listen with the diaphragm all over, so the diaphragm is on. Second intercostal space, right sternal border. Listen to the aortic area. I'm listening to make sure that there is no murmur noted. I can just hear the normal S1 and S2, which is present. All right, we're moving to the pulmonary area, which is the second intercostal space on the left sternal border. So you find this first one, find the second one, the left sternal border. Again, this is the pulmonary area, so I'm listening for any murmurs, making sure there's no extra noises. Just the normal S1 and S2 are present. The third one is the Erb's point, which is the third intercostal space, left sternal border. This one I will hear S1 and S2 equally. Okay. Moving down to the tricuspid area, which is the fifth intercostal space. 1, 2, 3, 4, 5. The left sternal border. No murmurs are heard. The last one is the mitral area, and that's going to be the fifth intercostal space, midclavicular line. So 1, 2, 3, 4, 5, and then midclavicular line. I'm listening for S1 and S2 and any murmurs. No murmurs are noted. I will say that, I'll do that when I do the rundown. Okay, and now the last thing I'm going to do is take your apical pulse for 60 seconds, but we're going to fast forward through the 60 seconds like it's pretend. So again, we're going to find your fifth intercostal space. 1, 2, 3, 4, 5. Midclavicular line. Find the apical pulse. Listen to it. Take the pulse for 60 seconds on my phone because my watch is not on my wrist. Okay. Fast forward up 60 seconds. All right, so we're going to do the same thing. Listen to all of those spaces again, just with the bell of my diaphragm, the little punch. Listening for the low tones. Find second intercostal space. 1, 2, right sternal border, aortic area. Okay. Second spot is pulmonic space area. 1, 2. Left sternal border. Third is Erb's point. 1, 2, 3. Left sternal border. Fourth is tricuspid. 1, 2, 3, 4, 5. Left sternal border. And the fifth is the mitral. 1, 2, 3, 4, 5. Midclavicular. Okay. All right. So the apical pulse has a regular rate in rhythm. The rate was 88 for 60 seconds. S1 and S present are S1 and S2 are present throughout all 5 heart sound areas. S1 is louder at the apex. And S2 is louder at the base. So the apex is at the bottom, and the base is at the top, which is flip-flop from lungs. Okay, and they are heard equally, S1 and S2 are heard equally over Erb's point. There were no murmurs noted in any of the areas that I listened to. Okay, that concludes our assessment of your heart and neck vessels. I want to go ahead and make sure that you're not in any pain, that we didn't cause any pain. So on a scale of 1 to 10, can you tell me again what that number, I'm sorry, 0 to 10. Can you tell me what your number is? 0 being no pain, 10 being the worst pain you ever felt. No pain. I appreciate that I did not cause you any pain. Thank you. Okay, is there anything can I do anything for you? Maybe get you a glass of water or a blanket? We're gonna help put your shirt back on. No water? Okay, nothing to make you more comfortable? Alright, is there anything else I can do? Or do you have any questions for me? No? Okay, thank you so much for your cooperation and thank you so much today for your time and cooperation. It really means a lot to us student nurses to get to meet new people and learn new skills, so we appreciate it a lot. Okay, thank you, Mr. Smith, and I'm for me and hygiene as I exit the room.